Sir, can we start the session?
Yes, sure, we can start.
Okay, sir.
Yeah.
Every sunset brings the promise of a new dawn. Get your thoughts calm down, get all blossom. Good evening, everyone. With great joy and immense exultation, I extend my warm welcome to all dignitaries, guests, and delegates present here for the Dr. Sudhir Raj N. Memorial Webinar Series organized by DIKSHA E-Learning Asadika Amrit Mahotsav in association with Ayurveda College, Coimbatore. In today's session, we will be discussing about concepts and clinical aspects of Pakshaghata Chikitsa by Dr. Yadu, Gopan.
Before starting the session, I would like to go through a few of the basic instructions to be followed throughout the session. For uninterrupted class session, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have disturbances-free session. In case of any disruption, please check your internet connection firstly, and if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any questions can be raised, posted in the chat box. Questions raised will be cleared at the end of the session.
Next, I would like to invite Dr. Kartiga, Assistant Professor, Department of Dravya Guna, Ayurveda College, Coimbatore, to deliver the welcome address.
Hello. Hello, good evening all the delegates who are joined here and our esteemed guest, Dr. Yadu Gopan, who is delivering the speech on the concepts and clinical aspects of Pakshaghata Chikitsa. On behalf of DIKSHA E-Learning and Ayurveda College, Coimbatore, and the whole team, I would like to welcome Dr. Yadu Gopan to this seminar session, which is going on a series with the eminent personalities speaking on that. So I would like to welcome Dr. Yadu Gopan to this seminar, and hopefully this seminar will become a fruitful session to all the delegates and then a very discussing and a promising one to all the students and the practitioners who have joined out there. So welcome, sir. And Dr. Yadu Gopan is the Assistant Professor at the Department of PG Studies in Chikitsa Department in the SDM Ayurveda College, Hassan. Well, we welcome you, sir, to the session. Thank you.
Thank you.
Thank you, ma'am.
Before starting the session, it's a great pleasure for me to introduce our guest speaker. Dr. Yadu Gopan has completed BA/MS degree from JSS Ayurveda Medical College, Mysore in the year 2016. He pursued MD in the Department of Chikitsa from SDM College of Ayurveda and Hospital, Hassan in the year 2019. He's currently working as Assistant Professor in SDM College of Ayurveda and Hospital, Hassan. He's an expert in management of hemiplegia and other neurological disorders. He has published various articles. He's currently running Pakshaghata OPD at SDM Ayurveda Hospital, Hassan. We are proud to have you here on this session today, sir. Now, without any further ado, we will turn the time over to respected Dr. Yadu Gopan, sir, to enlighten our minds with his knowledge. Over to you.
Thank you. Am I audible?
Yes, sir, you're audible.
Okay. Can I start it?
Sure, sir.
Okay, yes. So I really, first of all, I would like to thank the organizers of this webinar series, especially Dr. Akhil, who invited me to this presentation. So it's my, I'm really happy to be a part of this, to present, to share my understandings and a little clinical experience to all the guests and the members of this webinar. And I'm just really happy that this webinar is conducted as a memorial to Sudhir sir. He's also from the Chikitsa department only. So I would like to go to the topic in proper. So my topic of presentation is concepts and clinical aspects of Pakshaghata Chikitsa. So what is the reason behind selecting this Pakshaghata as a topic for this presentation? So as we know, Pakshaghata is one among the 80 Vataja and Anatmaja Vikaras. And Pakshaghata is considered to be one of the complicated disease among the 80 Vataja and Anatmaja Vikaras. Why? Because again, based on the Lakshanas, so we have the diseases like Vishwaji, Grudrasi, Apabahukam, or Khalli. So so many Vataja Vikaras are there. But among that, Pakshaghata is considered to be complicated based on its Lakshanas. It can present with different types of Lakshanas. And again, one more thing is, it will take more time for the recovery from Pakshaghata. And many of the times, total recovery or complete recovery is not possible in the case of Pakshaghata. So because of these reasons, it is considered to be a complicated disease. And so that is a reason. And again, as the Ayurvedic people, so we have a lot of things to do to contribute in the field of Pakshaghata, and we can more than any other branch of medicine. We have so many things to do the improvement of Pakshaghata patients, because as we know, the acute stroke cases, generally we correlate this Pakshaghata with hemiplegia as a result of any acute CVA or any other brain injury. So the acute cases will be managed by the modern counterpart. And after that, we will get the patients in the Pakshaghata avastha. So we'll get so many patients, and we can do with our own, Ayurvedic Shamanaushadis as well as the Panchakarma procedures. We can do a lot of, improvements in the condition of the Pakshaghata patients. So that is also one more reason why I selected this Pakshaghata for the presentation. And again, this Pakshaghata was my thesis topic in my post-graduation, and we run a Pakshaghata special OPD for under the Department of Kaya Chikitsa in our hospital. So these are the reason why I selected Pakshaghata for the presentation. And again, one more important thing, that is the concepts and clinical aspects of Pakshaghata. So what is the importance of discussing about the concepts? So we already, as the Ayurvedic persons, once you complete the BMS, we already would have studied about the Pakshaghata theoretical aspects in the Roganidhana as well as the Charaka Samhita, and again the Kaya Chikitsa also. So still, again, when we, many of the doctors, so they set a particular set of medicines to treat Pakshaghata. It may be some kashayas like, Sahajaradi Kashayam or Ashtavargan Kashayam, Maharasnadi Kashayam, or there may be some rasaushadis like Brihatvada Chintamani, Vada Gajangush Rasam. So, and we limit to that only many of the times. If it is in the OPD based treatment, we limit to very few medicines most of the times. But and in the IP also, very few types of treatment, maybe Abhyangam or Nasyam or Basti. So we may limit to a particular set of medicines in the IP treatments also. But we have, if we understand the concepts and the basic and theoretical part of Pakshaghata and the basic pathology behind Pakshaghata, both modern as well as Ayurveda, we can select based on our logic as well as our understandings. We can select a different set of medicines in different patients, because all the patients, though they are diagnosed with Pakshaghata, they are not the same. Their presentation may be different, their course of the Pakshaghata may be different, and totally, obviously the person to person, there will be a lot of differences. So according to their prakriti and their vikriti, what happened to their sharira, we can select the medicines or we can treat the patient. So that is why I gave some importance to the concepts also, theoretical concepts also. So again, if you go to the classics, we have Charaka Samhita as well as Sushruta Samhita and Ashtanga Hridaya also. And so there are again difference of opinion between the acharyas or between the samhitas. So again, if you consider Charaka Samhita, so in this presentation, most of the slides I would like to correlate with the modern as well as the Ayurveda. So we know that in Pakshaghata we have, or in the stroke we have the involvement of both the vascular as well as neurological aspects. That is both the blood as well as the nerves are involved in the Pakshaghata or in the stroke. Similarly, if you go to the explanation of Charaka's Pakshaghata as well as Sushruta's Pakshaghata, in Charaka's Pakshaghata, more towards it is about the Siras, Snayu, Shoshana, and what it is told. So we can consider that as a neurological aspect. But if you go to Sushruta's aspect, explanations, he explains most about the dhamani, involvement of dhamanis in the case of Pakshaghata. So that is nothing but the vascular involvement in the stroke. So here at the starting itself, we can correlate with the modern aspect where we have the involvement of neurological as well as vascular aspect in the development of stroke. So we are going to the topic in proper. So before going to that, again, bowing the head in front of vata. So we must, so it is like, if you read the topic Vata Vyadhi in detail, we may develop a respect towards Vata, because these three shlokas are taken from the Charaka Samhita Chikitsa's 28th chapter, Vata Vyadhi Adhyaya. So that is, it's like a bowing the head towards the power of Vata, or the, attributes of Vata. See the first shloka, Vayur Ayur Balam Vayur Dhata Sharirinam, Vayur Vishwam Idam Sarvam Prabhur Vayuscha Kirtidaha. So we know that Vata is spreaded all over the Sharira and all over the universe. It gives the Ayu, it gives the Bala, and it completely protects the Sharira, it stabilizes the Sharira, and Vayur Vishwam Idam Sarvam Prabhur Vayuscha Kirtidaha. So Vata is considered the Prabhu, or the Lord of total being. That's why so much importance is given to Vata. And the second shloka also, it is also again from the Charaka Samhita, Chikitsa Sthana, Vata Vyadhi Adhyaya, that is, Avyahata Gatir Yasya Stanastaha Prakrtau Sthidaha, Vayuhu Syat So Adhigam Jivet, Vita Roga Samashatam. So see, this is one of the most important shloka from Vata Vyadhi Adhyaya. That is, it is about the, how the Vata protects our Sharira. See, first one is Avyahata Gati, second one is Sthanastha, and the third one is Prakrtau Sthita. So if Vata is in these stages or is these conditions, it will protect, that is the Sharira. So Adhigam Jive, the person will live for so many years, Vita Roga, without any disease, and Samashatam, even 100 years the person will live without any disease. That is Nira, Anamaya, and Shatayu, more than for 100 years he'll live without any disease. If Vata in these three criteria, that is Avyahada Gati, that is nothing but the, so in Chakravarti commentary, he explains Avyahada Gati is nothing but Aparityakta Margam. Aparityakta Margam means Vata is on its own Gati, it is its own Marga. It has not go to any other Marga. It is traveling on its own Marga. Okay, there is no other Gati. It is in the Anloma Gati only. It is not, no, it has not went to the Pradiloma Gati. So that is Avyahata Gati. Gati is not affected. Then Sthanasthaha, that is, Sthanasthaha means there is, in the commentary, it is Na Vimarga. So Vata is on its own Sthana. It has not went to any other Sthana. It has not went to the Kafasthana or Pittasthana. It has not taken any dosha from its own Sthana to other location. So Vata is in the Sthanastha, its own location. So Na Vimarga. Then the third one, that is the Prakrtau Sthita. Prakrtau Sthita means Akshina Vruddha. There is no Vata Vriddhi, there is no Vata Kshaya. So if this is the condition, the person will live for 100 years without any disease. So that is what one of the another attribute why we have to protect the Vata, or why we have to take care of the Vata. And the next thing, this shloka is also on the same chapter. In the last part, it's explained. That is Kshayam Vriddhi Samatvam Cha Tadeva Avaranam Bhishak Vichnayaha Pavanadina Na Pramukhyati Karmasu. That is, we need to, as a good clinician, as a good doctor, we need to understand the Kshaya, Vriddhi, Samatva of doshas. Obviously, we know that because it is our Arogya, Swastha Lakshana is again the Samadosha Avastha. That is Kshaya, Vriddhi, Samatva. We need to understand the Kshaya of dosha. We need to understand the Vriddhi of dosha, then the Samatva of dosha. And one more important thing, most important concept, that is the Tadeva Avaranam Bhishak. Avarana has also to be taken care. And if we Vijnayaha Pavanadinam, if you understand these conditions of Pavanadi doshas, Vadadi doshas, then there will not be any confusion in the treatment aspect. That is Na Pramukhyati Karmasu. So this is a brief introduction to the Vata Vyadhi as such, and the importance of Vata. So now we are going to the topic in proper. So about the stroke, the relevance of the topic, that is a stroke. So stroke is, again, as you know, it's one of the complicated disorder, and the recovery. So this is about the acute stroke. So acute stroke is an acute sudden attack, the brain damage or neurological damage, and it can present with stroke has some clinical outcomes. So what is the outcome of stroke? Outcome can be three types. One is complete recovery from the stroke. Just like in the case of transient ischemic attacks, within 24 hours of the stroke, patient will come back to the normalcy. That is recovery. And disability. Disability can be hemiplegia, it can be hemiparesis, that is complete loss of function or partial loss of function, and its complications like again this bowel bladder dysfunction or the speech deformities. And again another outcome of stroke is death itself. That is mainly in the hemorrhagic strokes. Most of the times there is chance of death, and the prognosis of hemorrhagic stroke is also, if it is not emergency, if emergency management is not given, the chance of death is more in the hemorrhagic stroke. And there are some risk factors of stroke also. Again, as we know, like risk factors like hypertension, diabetes mellitus, dyslipidemia, and stress, alcoholism, smoking. These are the risk factors of stroke. So by restricting these, risk factors, if it is, it is preventable risk factors like, dyslipidemia, diabetes, or hypertension. This can be prevented by our, lifestyle modifications or diet modifications. And again, alcoholism or smoking, this can be stopped. So this is also a preventive aspect. And again, one more important thing, as per WHO, stroke is considered to be the second major cause of death worldwide. Second major cause of death worldwide. And the prevalence of stroke in India, it's a large, grade, or class of prevalence. That is 140 to 922. That much patient can be affected in 1 lakh. That is the prevalence of stroke in India. And so stroke mainly, as acute cerebrovascular accident can be of 2 types, that is hemorrhagic as well as infarction. And 87% of the cases are, infarct cases. And out of that, 10% of the patients die usually, maybe without the treatment. And the rest part is hemorrhagic stroke. So, and again, one more thing, among the stroke survivors, almost 50% of the patients will experience the disability. That is either hemiparesis or hemiplegia. So Pakshaghata is such a disease which cripples the day-to-day activity, because once the patient is getting that Pakshaghata, he's affected with Pakshaghata, his total lifestyle will be changed, his routines will be changed, he'll be restricted, his movements will be restricted. So this is the relevance of this topic of Pakshaghata. So again, as we know, acute stroke as well as hemiplegia are there. So again, acute stroke is nothing but a rapid appearance of focal deficit of brain function. That is focal deficit. That is only a particular part. A small part of brain is affected, not the whole brain. We know, like in the MRI findings we see or CT findings we see, there may be only small infarct will be there, or there may be sometimes large infarct, or hemorrhage may be there in a small area. That is the focal deficit. Only a particular focus of the brain is affected, not the total brain. But this can lead to the hemiplegia. That is the most common outcome is hemiplegia. And again, higher mental function can be affected, or the sensory loss may be there, or visual field defect can be there, or brainstem damage and a loss of coordination may be there. So only a focal deficit, small damage in the brain, small location in the brain is affected. Though it is the case, this is going to, the outcome is really complicated. That is acute stroke. And the hemiplegia. Hemiplegia is the most common outcome of, stroke, acute stroke, which we consider as the Pakshaghata. That's a loss of strength in the arm, leg, that's in the one side of the body, or sometimes on the face on one side of the body. Hemiplegia refers to severe complete loss of strength. That is, hemiplegia is a severe grade of that outcome of stroke. That is a complete loss of strength. And the hemiparesis, that is the mild loss of strength. That is, we might have seen some patients. Some patients of Pakshaghata will have the complete loss of movements will be there. Some patients will be having that based on the muscle power. They may have little movement. So that is a hemiparesis as well as hemiplegia. Okay. And one more important thing is, these two things have references in our Ayurvedic classics also. That is what I'm going to discuss next. That is the two conditions which is explained in Charaka Samhita. One is from the Siddhisthana 9th chapter, Trimarmiya Siddhi, and the second one is from the Vata Vyadhi Adhyaya. So these two things can be correlated with the acute stroke as well as the hemiplegia. See the first one, that is a Mastishka Marma Abhigata. Okay, Mastishka Marma Abhigata, that is the brain is affected. Mastishka is considered to be one of the marmas, and that is affected. Any Abhigata to that particular thing, which is going to cause some symptoms. And so many symptoms are explained. That is Shirasya Abhigate Manyastamba. From Manyastamba, so many symptoms are explained. But whatever I have marked in these red lines, these are very much correlated. This can be correlated with the acute stroke. See, Ardita, first one is Ardita. Chakshu Vibrama, that is the visual field defects. Brahma, that is a confusion or the loss of reduced consciousness. Moha, again the same thing. Then Cheshtanasha, one more important thing, that is a Cheshtanasha, loss of function. itself is stored as a Lakshana of Mastishka Marmabhigata. Then Kasa, Shwasa, Hanugraha, Muka, Gadgadatva, Akshinimira. That is again the loss of speech. It can be dysarthria, or it can be aphasia also. Then the eyelid movements may be lost. And again, Swarahani related to the speech. Then Vadana Jihmatva. Jihmatva is nothing but the Vakrata of the Vadana, that is nothing but the Ardita. Okay, again. So these are the Lakshanas of Mastishka Marma Abhigata, an acute stroke. And again, one more, the cause of Mastishka Marma Abhigata. So Abhigata can be of two types. That is, one is Dosha Abhigata and the other one is the Bahya Abhigata. Dosha Abhigata is, it can be correlated with the CVA or hemorrhage in the brain, or in the that is hemorrhagic stroke, or in fact ischemic stroke. And Bahya Abhigata, it can be any brain, external brain injury, maybe as a result of some RTA or any blunt injury to the head. This can be correlated as the correlated with the Bahya Abhigata. So this is the acute stroke. And the next one, that is the Pakshaghata, hemiplegia stage of. So this is nothing but the outcome of acute stroke. That is Hatvaigam Marutam Paksham, Dakshinam Vamameva, Kuriya Cheshta Nivrutim Hi Rujam Vakstambhamevacha. Again, according to Charaka, Vatavyadhi Adhyaya, that is the Cheshta Nivrutti and Ruja in one Paksha of Sharira, that is either Dakshina or Vama, that is a right or left Paksha, that is one side of body will be affected with these symptoms. That is Pakshaghata, that is commonly correlated with the hemiplegia. And there may be Ruja also, pain will also be there. Cheshta Nivrutti, that is a loss of function, and Vakstambha, that is the loss of the difficulty in the speech will be there. So these are the Pakshaghata Lakshanas. So we have in modern two stages of the stroke, that is a acute stroke stage as well as the outcome, that is hemiplegia stage. In Ayurveda we have Mastishka Marmabhigata stage as well as the Pakshaghata stage. So this is also one more important understanding. So again, as we told, there are two types of stroke. That is, one is the cerebral infarction. That is almost 85% of the patients will be suffering from the ischemic stroke or cerebral infarction, and the 15% will be suffering from the intracranial hemorrhage. So in this also we can have a Ayurvedic correlation. That is nothing but the Dhadukshaya as well as Avarana. So as we know, for any Vata Prakopa to occur, there are mainly two causes. That is, one is Marga Avarana and the other one is Dhadukshaya. So many times the cerebral infarction or ischemic stroke is correlated with the Avarana Janya Pakshaghata and cerebral intracranial hemorrhage. That's a bleeding. It is considered with the Dhadukshaya. So there it is, in the brain we have the Dhadukshaya, that is the bleeding, that is Rekta Dhadukshaya. And in generally in the hemorrhagic place stroke, many a times we have the muscle wasting and all. So that is a Sarvadahiga Dhadukshaya also we can consider, not only in the brain. And one more thing in the previous slide, that is we have explained the Pakshaghata Lakshana according to Charaka here, but Sushruta explains another two symptoms. That is same. One is Akarmanyata, that is a Cheshtanasha only. Another thing is Achetana is explained by Sushruta. So Akarmanyata as well as Achetana, that is nothing but Akarmanyata, loss of motor function. Chetana is the loss of sensory function. So again, see the clear-cut understanding of the modern condition clearly explained in Ayurveda. That is Achetana as well as Akarmanyata, motor as well. Akarmanyata is motor loss, and the other one is Achetana is sensory loss. So that for this also we have a reference in Ayurveda. So again, the clinical classification of stroke, we have different types like a TIA, transient ischemic attack, where the stroke will be completely reverted back to the normalcy within 24 hours. Then the stroke, there is a next, another condition where more than 24, it will not come to the normalcy within 24 hours. So it will progress more than 24 hours. With there will be a loss of focal brain function. Next is progressing stroke. Many a times in the case of hemorrhagic stroke and even in the infarction also, it is not the focal neurological deficit worsens after the patient first presents. That is, even after the first symptoms occurred, it will be progressing. There is a progressive bleeding may be there, or the size of the infarct may be increasing, volume may be increasing. So that is a progressing stroke. Then the completed stroke, that is a focal deficit. Whatever occurred in the brain, that is complete. It is stopped. That is a infarct occurred, there is no progression of infarct. Hemorrhage occurred, there is no progression of hemorrhage. That is, once it is occurred, it is not progressing. That is a completed stroke. So these are the clinical classification of stroke. And in Ayurveda, again, we can make the diagnosis based on the Avarana, as I told, Avarana is a cause of Vata Prakopa. That is, we have this classification is given by Madhanita as well as Susra Samhita. Pittavrta Pakshaghata, Kaphavrta Pakshaghata, and Pitta Kaphavrta Pakshaghata. That is, in Pittavrta Pakshaghata, we have lakshanas like Daha, Murcha, Brahma, along with the Pakshaghata lakshanas. Okay. So along with the Pakshaghata lakshanas, we have the Daha, Murcha, Brahma. Then we can understand it as the Pittavrta Pakshaghata. Then in Kaphavrta Pakshaghata, we have lakshanas like Gaurava, Stamba, and along with the Pakshaghata lakshanas. Then Pitta Kaphavrta Pakshaghata, combination of the above such lakshanas can be seen. Okay. So again, Sushila gives one more account about the Sadhya Sadhita of Pakshaghata. We will not get this thing from the Charaka Samhita. In Sushila Samhita, Sadhya Sadhita of Pakshaghata, that is the prognosis explained. That is, Shuddha Vatahatam Paksham, Pritra Sadhitam Viduhu, Sadhyam Anyena Samsrishtam, Asadhyam Shaya Hetukam. So here we can, it's like, something tricky, because generally in any other disease, the Ekadosha condition is, that is Ekadoshanugam Sadhyam, Didosham Yapyam Uchede, it is told. That is many other diseases. Ekadosha condition is considered to be Sugha Sadhya, and Dvidoshaja is considered to be Kritra Sadhya, and Tridoshaja again Asadhya. But here in Shuddha Vatahata, that is Shuddha Vatahata Paksha, that is only Vata is involved in Pakshaghata, then it is considered to be Kritra Sadhitamam. And Sadhyam Anyena Samsrishtam. If Vata is associated with any other Pitta or Kapha, that is Samsrishta, Paradosha Samsarga, along with Vata is occurring, or symptoms are seen like that, it is considered to be Sadhya, and Asadhyam Kshaya Hetukam, that is Dhadu Kshayaja Pakshaghata. Most of the time it is Asadhya. So you can see that is hemorrhagic stroke or high rate of initial mortality, that is death commonly occurs more in the hemorrhagic stroke, according to this is told by as compared with the ischemic strokes. So this can be compared again. Kshaya Hetuja Pakshaghata can be mortal, the Asadhya. Okay. So Kshaya Hetuja, again Kshaya is a cause for Vata Prakopa. And here in this case, it is about the Shonita Atisrudika Srudikrita Dhadukshaya. That is a Rekta Atisruti, that is Rekta Srava, leading to the Pakshaghata. That is nothing but the hemorrhagic stroke. Okay. So this is one more slide where we discuss about the other conditions, that is having the Pakshaghata presentation. That is what nothing but most of the times we discuss or we correlate Pakshaghata with only stroke or CVA. But even in Charaka Samhita, Pakshaghata is not alone explained. Along with Pakshaghata, Ekanga Vata as well as Sarvanga Vata is also explained. So based on that, Charaka himself explains some other similar disorders. So likewise, in the modern also, we can correlate Pakshaghata not only with the CVA, we can correlate it with the multiple sclerosis or some arteriitis. Takayasu arteriitis is a condition, or any other autoimmune encephalitis, or again the electrolyte imbalance like hypo or hyperkalemic periodic paralysis, or GB syndrome, or myelomalacia, that's cervical myelomalacia, or compression myelopathy. These are also some conditions which can present with the Pakshaghata presentation. That is the Cheshtanasha and the Ruja can be seen in these disorders also. Okay, so Pakshaghata presentations can be seen in these disorders also. So now we are going to the Chikitsa Sutra of Pakshaghata. That is, see, first one is from Charaka Samhita, second shloka is taken from Ashtanga Hridaya Chikitsa. See, simple shlokas are explained. Svedanam Sneha Samyuktam Pakshaghate Viryasanam according to Charaka. Snehanam Sneha Samyuktam Pakshaghate Viryasanam according to Ashtanga Hridaya. So, on looking these shlokas, we may think I was explaining Pakshaghata as a complicated disease, and again in Charaka Samhitas also it was explained as a complicated disease. But why these simple Chikitsa sutras for this particular disease? But this is not simple as such. See, Svedanam Sneha Samyuktam Pakshaghate Viryasanam. He explains only Svedana.
Yeah.
Am I audible?
Yes, sir, you're audible, sir.
Okay, yes. So Svedana can be of different types. In Pakshaghata itself, we can use Nadi Sveda or Bashpa Sveda, Patrapinda Sveda, or again Shashtika Shalipinda Sveda. So different types of Svedanas. And again Snehana. Snehana is also again different varieties. It can be Bahya Svedana, Bahya Snehana in the form of Abhyanga or Taila Parisheka, or in the form of any local Snehana, or again Abhyantara Sneha, It can be in the form of, Sneha Pana itself, and some other Sneha methods like Nasya, Navara Nasya, or Basti, Sneha Basti, Anuvasana Basti, Matra Basti. So again, under this single word or this single line, so many understandings are there. And again, Virechana is also indicated for Pakshaghata. Why Virechana in Pakshaghata? Virechana is mainly given for the Pitta dosha. But why in Pakshaghata? Because if we go for the Vatasya Upakramam, Sneha Sveda Samshodhanam Mruduhu, it is told. That is for the Mrudu Shodhana is indicated in the Vatasya Upakrama. And Virechana is a method through which we can attain the Vatanulomana. It can be used for the Koshta Shuddhi also, because we are the main treatment in any Vata Vyadhi is Basti Chikitsa. Before going to the Basti Chikitsa, it is better always to have a Koshta Shuddhi. For that purpose also, Virechana is indicated. Okay. And again, one more thing is the involvement of Rakta Dhatu in Pakshaghata. So obviously, Rakta Dhatu is involved in the form of the vascular component of the stroke. So by that also we can, or in the Dhatu Shaija Pakshaghata also Rakta is involved. So Rakta Dhatu, for Rakta Dhatu and the Pitta dosha, Virechana is a treatment. So in that way also we can understand the use of Virechana in the case of, and even in the case of Avarana also, Virechana Chikitsa is indicated. So in that way also we can understand the Virechana in the case of Pakshaghata. So that is the importance given to Virechana and what is that? This Snehana and Svedana in the Pakshaghata. But this is not a simple, though the slokas looks simple, its understanding or the wide varieties of treatment behind the shloka is very much. Okay. So the same thing based on the this same thing can be seen in the Sushruta's explanation of the Pakshaghata Chikitsa. So these are the Chikitsas explained by Pakshaghata. Explained by Sushruta Samhita in the for Pakshaghata Chikitsa, that is on the Mahavata Vyadhi Adhyaya, shloka number 19. So we have so many lines. So I would like to explain each line because this is the basic treatment. We are taking this as a base, this Chikitsa Sutra. Then we are treating. We are not simply treating. We're seeing it as a Pakshaghata. We are not blindly going for an Abhyanga. We are not blindly going for selecting a Basti. Based on the condition of the patient, we need to select. So for that purpose, first only Sushruta explained the criteria of selection of a Pakshaghata patient. What type of patient should be selected for the treatment? That is, first one is Pakshaghatopadrutam, Amlana Gatram, Sarujam, Atmavandam, Upakaranavantam cha Upakramit. So this type of patient should be treated. The other type should be avoided. That is Pakshaghatopadrutam, Amlana Gatram. Amlana Gatram in the Dalhana commentary it is told Ahina Gatram. Due to Pakshaghata, there should not be large, what is that? So many physical complications to the Sharira, to the patient. That is Sharira Chaya or the Hinata should not be there. That is the Pakshaghata patient should be, we know that is the patient should be able to withstand the treatment. There should not be any complete emaciation due to the disease. Or if the patient is completely emaciated, it will be difficult. Or if he is, so many, if there is a severe range of any fatigue in the patient, then also it will be difficult to treat the patient. That is Amlana Gatram. He should have an Amlana Gatra. Sharira should be good. And Sarujam, that is again one more important thing. With the pain, the patient should have pain, not without pain. That is also one more important thing. With the pain, we should, that is Charaka also explained Ruja as a symptom. And with the pain, we should, the patient should have pain. That is, such a patient will have the good improvement. So what is the, why that pain he specifies? That is in the Sushruta commentary it is told, that is the Pakshadam, Achetanam, Avetanam, so Asadhya it is told in the Dalhana commentary. That is, already I told, Sushruta explains Achetana, that is a sensory loss as a Lakshana of Pakshaghata. So if along with the Achetanam, Avedanam, if Vedana is also not there, if pain is also not there, then it is considered to be Asadhya. So how we can correlate this particular model? That is, we do the sensory examination of the patient. So whenever there is CNS examination is, so sensory examination is also a part of, first we will go for the higher mental function, then the language, all those things we'll examine, then we go for the motor examination, then we go for the sensory examination, then we go for the coordination test, then the tendon reflexes we'll examine. So in this manner, we'll examine the neurological cases. So there is an importance of sensory examination.
So we know that there is in sensory examination, we examine for the fine touch or sharp touch and the pinching to induce the pain. And even in the case of EVM, that is a GCS, Glasgow Coma Scale, also to assess the coma, also the pain sensation is very much important. That is nothing but the Sushruta explanation. Sarujam, if pain is there, we can consider it as a good. At least there is no complete loss of sensation. Achetana is there. There is a fine touch or sharp touch is, it may be lost, but by pinching, if pain sensation is present, we can consider it as a good sign. So if the patient is with the pain, then you can consider it as a good sign. That's why Sushruta explained it. And even in the clinically also, once the patient, first initially the patient may not have the pain, and after some course of treatment, if he develops pain, that is also considered to be a good sign of improvement. Okay, that's why Saruja, with the pain, such patient should be taken for the treatment. Then Atmavantam, the patient should have a confidence on the treatment. Upakarnavantam, he should be, he should have that, like in Ashtanga, it is told, Adyo Rogi, it is told. He should be equipped. He should have that, he should be able to afford the treatment of Pakshaghata. Because below that, so many different types of treatments are explained. So for that purpose, patient should be able to afford the treatment. Okay. So this is the selection criteria of Pakshaghata patient according to Sushruta. And next we will go to the Chikitsa, that is Tata Prageva Sneha Svedopapannam Mrudunam Shodhanena Samshodhya. Okay, same thing what is told in Charaka and Ashtanga Hridaya, that is Prageva. First line of treatment should be Snehana, Svedana, and Mrudushodhana. That is nothing but the Vadasya Upakrama. So Sushruta also says the same. And then after that, after giving this, go for some Anuvasya Astapyacha. That is Tatra Prageva Sneha Svedopapannam then Anuvasya Asthapi. That is about the importance of Basti. So Basti is the Ardha Chikitsa in Vata Vyadhi. It is having very much importance in Pakshaghata also. That's why ultimately our main treatment will be Anuvasana as well as Asthapana Basti. But before that, we need to go for Snehana, Svedana as well as the Mrudushodhana. Okay. Then the next thing, that is the next line. Yadha kalam akshepaka vidhanena upachare. So what is this? Yadha kala is highlighted there. What is that? According to the commentary, that is, there should be a time gap between each treatment. That is, he gives an example like Tadyada Vantasya Pakshat Virejana. We will do Virejana after 15 days after the Vamana. Then Viriktasya Saptaratrat Anuvasanam. That is, after Virejana, only after 7 days we will go for Anuvasana Basti. As per the classics, Anuvasitasya Sneha Lakshane Sati Asthavanam. So if we are doing the classical procedures like Snehapana and Vamana Virejana, then the Anuvasana Basti, this is the time gap should be given. So likewise, even in the Pakshaghata also, we need to give a gap between each treatment. We should not treat the patient for a whole 1 month or 2 months together with the same treatment. That will make the patient again tired. So there should be Yadha Kalam, that suitable time gap should be given while treating the patient clinically. Then again, Akshepaka Vidhanena Upacharit. That is, the patient should be treated with the Akshepaka Vidhana in the form of like Akshepaka Chikitsa or Apatantraka Chikitsa is explained in Sushruta Samhita. In that form, we need to treat the patient. So here also again one more important thing, that is again we have discussed 2 stages of Pakshaghata, that is Mastishka Marmabhigata and the Pakshaghata Avastha. So in Mastishka Marmabhigata Avastha, that's in the acute stroke stage, patients obviously go to the modern treatment, emergency treatment. But for Mastishka Marmabhigata also, Charaka explains treatment. That is nothing but about the Tikshna Nasya Prayogas, Samnya Prabodhaka Nasyas, or Tikshna Prayogas. That is the Avapida Nasya, Swarasa Nasya, or the Churna Nasya. Such a Tikshna Nasya can be given in the because many of the patients may be in the acute stage, he may be having that loss of consciousness. So there we need to do the Samnya Pramodana, or we need to go for some emergency management. So in Ayurveda, obviously the Tikshna Chikitsas are considered to be the emergency management. Maybe in the acute pain relief also, we go for Sira Vedana, or we may go for this Agni Karma. Likewise, here in the brain damage, the emergency management is mainly the Tikshna Nasya. It can be Avapida Nasya, it can be the Churna Nasya. So Sushruta also says Pakshaghata should be treated in the starting stage according to the Akshepaka Vidhana. So Akshepaka Vidhana, Akshepaka Chikitsa also explained by Sushruta, where he explains about the Avapida Nasya, that is a Tikshna Nasya, That is given for the Shirashuddhyartham, it is told. That is Shiro Vireshana Nasya or Tikshna Nasya should be given in order to clear the Vata Marga in the Shiras or Vata Marga in the Mastishka. So that's why Tikshna Chikitsa is indicated. So Charaka as well as Sushruta also explains in the acute stages, we need to go for the Tikshna Chikitsa. And once we come to the Pakshaghata Avastha or the hemiplegia state, then we have to go do the Vata Vyadhi Chikitsa. That is nothing but the Snehana Svedana, different types of Snehana Svedana, Shodhana or Basti, etc. Okay. So this understanding is very much important. We have two stages of Pakshaghata, Mastishka Marmabhigata Avastha or the acute stage, Pakshaghata Avastha or the hemiplegia stage. Okay. In both stages, we have the managements. In acute stage, it is about the Mastishka Marmabhigata Chikitsa. In hemiplegia stage, it is about the Pakshaghata Chikitsa. But most of the times, we are not treating the acute stage. Okay. So, and again, so that is about the Akshepaka Vidhanana Upachare. Then Sushruta explains some particular aushadhis, particular treatment for Pakshaghata. This is very much important. See, Vaisheshikas Chatra Mastishkyam. So we know the 4 types of Mastishkya or Modni Taila. Among that, Shirobasti is given to the, it is considered to be the most, important one. It is the most beneficial one, Shirobasti. So Sushruta directly explains Shirobasti should be given in Pakshaghata. Even in Ardita also he explains Shirobasti. So Shirobasti is considered to be the one of the most important treatment. Then Anutailam Abhyangarte. Anutaila should be used for Abhyanga. Particularly he says Anutaila should be used for Abhyanga. But this is not the Anutaila which is used in Chalakya Tantra or in the Nasa Roga or in the Karna Roga. But we do use the Anutaila. This is not the same. So in Suchita Samhita, we will get reference of 2 types of Anutaila. That is Chalakya Tantrokta Anutaila as well as the Vata Vyati Ukta Anutaila. That is the, so this is that Anutaila. That is, this is a special preparation which is prepared. Most commonly, we are not using that because we know the in the past times there was oil mills were there, that where they have used a particular yandra. That's a wooden yandra, and the cattle used to, the bulls used to, rotate that yandra for the oil extraction. So that yandra was completely made of, that oil extractor yandra was completely made of wood. And the preparation of Anutaila, the yandra which is used for so many years for the oil extraction, that wood should be cut into pieces. Then it should be added in the oil. It should be made kashaya. Then the taila paga should be done. That is the Anutaila explained by for Vata Vyadhi. So this is used for the Abhyangarte. Then Salvanam Upanaha. The Salvana Upanaha is also a Upanaha Sveda. This is also commonly practiced, Salvana Upanaha. That can also be used for the Pakshaghata Chikitsa. And Balatailam Anvasanarthe, that is, Baladaila should be used for the Anvasana Chikitsa, Anvasana Basti. Particularly, he says. And even if you go for Ardhita Chikitsa, we'll get Shira Bala reference there. Here in Vata Vyadhi, Sudha Baladaila should be used for the Anvasana. And again, the last one, that is also one more most important concept, what we generally explain to the patient. That is, Evam Atantridam Trim Chadurova Masan Upakramet, Kriyapadam Upasevet. That is, at least for 3 to 4 months, we need to treat the Pakshaghata patient. Then only we can expect the improvement. Otherwise, within a single course of treatment, we cannot expect more improvements in the Pakshaghata. Okay. That is the Atantridam. There should not be any relaxation or lassitude in the treatment. Treatment, if you are planning for a course of treatment, it should be complete. It should not be stopped in between. That is the Atantridam. That is Atandridam, Analasaha it is told. Alasada should not be shown in the Pakshaghata Chikitsa. Both from the doctor's side as well as from the patient side. Okay. And the Trim Chaduravamsa, at least for 3 to 4 months. Even in the Harrison, if you read the Harrison's textbook of medicine, there also about the stroke treatment or hemiplegia treatment, he explains at least for 3 to 4 months it should be treated. So that is what we are generally explaining to the patient also. So this is about the complete theoretical aspect about the Pakshaghata Chikitsa according to Sushruta as well as different Charaka and Vagbad. Okay. So now we'll go to the clinical aspects of Pakshaghata Chikitsa. Sorry. So these are the concepts generally we use in the Pakshaghata Chikitsa. That is, as I already told, Mastishka Marmabhigata Chikitsa. Then Samnya Prabodhana, that is in the unconscious patients, we used to go for the Samnya Prabodhana Asyas. And again, Vadasya Upakrama. And once we have tried one Chinese method also in our IPD, that is, we have read somewhere in Chinese medicine, it is exactly similar to the Rakta Mokshana. to do the samya prabodhana or to treat the stroke cases. That is by pricking the finger, all the 10 fingertips we used to prick. That was a Chinese medicine, but we didn't get much more improvement in that by that treatment. But somewhere we read that and we have practiced it also. So and again, vadasya upakrama. Obviously, since pakshaghata being a vata vyadhi, vadasya upakrama should be done. Then comes to pakshaghata chikitsa. And another important concept is like avarana chikitsa. Avarana is a most beautiful concept explained in vata vyadhi. So we know in vata vyadhi we have different types of vata vyadhi. Like gata vata is there. Then Ashayagata vata is there, Kevala vata is there, Nirupastamba vata is there, Avruta vata is there, and Avarana also again different types of Avarana. So Avarana chikitsa is also very much important. That is based on the Pittavruta or Kaphavrata Pakshaghata Lakshana. Then Kevala vata chikitsa. If there is no other dosha involvement, we can purely go for the Kevalam Nirupastamba, Ado Snehi Upachara that is told. That is, if Asam Srishta or Anavruta Vata, then we can go for the Kevala Vata Chikitsa. So these concepts are used in the management of any patient of Pakshaghata. That's why we cannot go blindly for a particular kashaya or blindly for a particular treatment. We need to have an understanding of these concepts also, what I already explained in the Chikitsa. Okay. So now we'll go to some case studies. So this was a patient where we have diagnosed it as Pittavrata Pakshaghata because the patient had symptoms like, as I told, Murcha or Daha, like, that Murcha action, like the patient was unconscious, he was drowsy, loss of consciousness was there, and bowel bladder incontinence was there, and weakness of the right upper and lower limbs, along with the loss of speech, that is Vakstamba was also there. These were the symptoms seen. And the Glasgow Coma scale, the consciousness was very less, that is 5/15 was there, and the muscle power was also 0 in the right side, complete 0 in the right side, and the left side it was again complete power was there, and reflexes, it was exaggerated reflexes in the right upper and lower limbs. So this case was, and it was a case of TIA actually, not actually, it was a complete stroke. It was a transient ischemic attack, but within 24 hours we got the patient. I think within 4 hours or 5 hours we got the patient, and he was admitted. So this was the finding of the acute infarct was seen in this case, left temporoparietal region, and the treatment given was, this is a list of treatments that we have given. First only we went to the Lashona Swarasanasya. So Lashona, it's a Tikshna Dravya with the Swarasa. It is complete. It was clearly made. Fresh Lashona was taken, and the it was pounded. The Swarasa was taken, and the Nasya was given 5 drops in each nostril. TID dose we are giving, the 3 times we are giving the Lashona Swarasa, because it is a Samya Prabodhaka Dravya. Directly in the Ashtanga Hridaya as well as in the Charaka Samhita also, Samya Prabodhana should be given with, it is told, it will be given with the Avapita Nasya, that's a Swarasanasya. Either Lashona Swarasya or Palandu Swarasanasya can be given. So this Nasya was given as a Samya Prabodhaka, and even since it is a ischemic stroke, we can correlate with the Avaranajanya Pakshaghata. Lashona is considered to be the one of the best Avaranahara Dravya. It is told as Lashona Rasayana in Ashtanga Hridaya, where it is told as Lashona Rasayana. It is best Avaranahara Dravya, and Lashona is good for the Vata Vyadhi also. So based incorporating all these concepts, we have decided to give the Lashona Swarasanasya, and by giving the Lashona Swarasanasya, within the first day itself, we got the response from the patient. That is, his consciousness was improved, and again the movements, he was started obeying to the commands. Though it was many of the times only after the 24 hours in TIA cases we will get the improvement. But with the Lashona Swarasanasya, patients he was triggered. There was a trigger to his brain, and his consciousness was slowly improving. Okay. And so this treatment was continued. So he, complete. Though it was since it was the, what is that? TIA. His consciousness completely regained. He started walking also. So then after, so acute stage. It was an acute stage. We got the patient. We given the Mastishka Marmabika Chikitsa, nothing but the Tikshna Prayoga we gave, and the Neuro HT was a capsule. We used to give so it has different, Shamanaushadis like, so Rasaushadis like Vata Gajangush Rasa, Bharadva Chintamani Rasa. Such Rasaushadis were there in the Neuro HT capsule. We used to give the Rasaushadis in the sublingual form, because and that also we have tried sublingual application of patients. Immediate relief we used to give, mainly even in the muscle power also. We used to get the improvement within a single application of this sublingual application of Rasaushadhi. So that's why we gave this medicine sublingual. You can also practice this sublingual application of this patent medicine. We generally use NeuroXT, Palsineuron, Neuron tablet, Neurodex. This or any other Rasaushadhi can also be pounded and it can be given in the sublingual. So we'll open the capsule, we'll give that or put that powder in the sublingual. Okay. And again, after that, once it came to the Pakshaghata avastha, we went for the vata vyadhi chikitsa. We have given the grita, abhyantara, kalyanaga grita, because his speech was little, speech as well as GCS, commas, consciousness was also little, it was subnormal. So we have given the kalyanaga grita and Maharashtra DIKSHA, that's a vata vyadhi, harakashaya, Pakshaghata, it is indicated. So we have given this. And he even, we have, after this course, we have gone for Saraswata Arishta also. Then Matra Basti was given with the Manjishtadi Taila. See, this Manjishtadi Taila, many of the times we'll choose Manjishta for the skin disorders. It may be Manjishtadi Kashaya or Manjishtadi Taila also. You may choose it for the, skin disorders. But Manjishta, as we know, it has direct effect on the Rekta Dhatu. This can be used in Pakshaghata also. There is a Sirasnayu Shoshna is there in Pakshaghata. Involvement of Rekta is there in Pakshaghata. Involvement of Damanis are there in Pakshaghata. So based on these concepts, some Rekta Prasadaka Dravyas or which promotes, which nourishes the Rekta Dhatu, that can also be used in the Pakshaghata. That's why we have done Manjishtadi Taila Matra Basti in the Pakshaghata case. So there was complete regaining of this bowel bladder function also, and GCS Glasgow Coma Scale was also improved. So the patient got immediately, because it was a TIA case, he got sudden relief also. So this is another Pakshaghata where we diagnose it as a Kaphavrata Pakshaghata, again based on the symptoms. So this was not a TIA case, it was a stroke case only, that is complete stroke case. So there was weakness of left upper and lower limb. Along with the weakness, the patient had a heaviness as well as stiffness. That is, Gaurava was there. So based on this Lakshana, we diagnosed it as a Kaphavrata Pakshaghata. Okay. So that heaviness was also seen, and some other Kaphavrata Vata Lakshanas were also seen in the patient. So based as a female patient, we had this symptoms. We diagnosed just Kaphavrata Pakshaghata. So these were the findings. That is a Glasgow Coma Scale. It was 15 by 15. The muscle power, it was in the left upper and lower limb. It was the upper limb, it was 2 by 5, and the lower limb, it was 3 by 5. And right side was completely normal. And there was exaggerated reflexes in the left side, affected side. Here also the treatment you can see. See, here we have given the Lashona Swarasana. Again, here the aim of giving Lashona Swarasana, it was not to improve the consciousness, because the patient was completely conscious. And here we gave that Lashona Swarasana as a Avarana Haranasya, because Lashona is an Avarana Haradevya. And in that manner, we gave the Lashona Swarasana here in this case. But in the previous case, both Avarana as well as the Samnya Prabodhana also we gave Lashona. And again, Sarvanga Udvartana was given with the Bashpa Sveda. So generally, the Udvartana, Udvartanam, Kafaharam, Medasaha Pravilayanam, it is told. So as a Kafahara method, we went for Udvartana. And in some patients, we go for this, Parisheka also. Whenever this peripheral, this is also a clinical aspect. This peripheral neurological symptoms are seen. Or some, for example, in some patients, there may be some parasthesias, abnormal sensations may be there. Or there may be, sensory deficit will be there in some patients. And in some patients, there will not be any sensory deficit. Only there may be motor loss. So, function deficit will be there. So, if in the, motor deficit is nothing but it's a, deep condition. And the sensory loss, it can be considered as a peripheral condition. So, in many of the peripheral conditions, Parishega is found to be more effective. And in the deep motor conditions, the Udvartana is considered to be more beneficial. Okay. Because Parisheka is a Parisheka Dravasveda, and it is again Pittahara also. So in sensory affected conditions, Parishega found to be, this is again based on the clinical experience I am talking. There's a Parisheka found to be more effective in the sensory losses as well as the motor losses. Udvartana found to be more effective. And why we have to this Udvartana as well as Parisheka, both are types of Langana only. One is Rukshana, one is Svedana, but both comes under broad classification, that is Langana. Why we have to give Langana, though it is a Vata Vyadhi? Because Vata Vyadhi generally we go for Brahmana, generally we go for Snehana, but why we have to go for the Langana? That is again based on according to Ashtanga Hridaya, before going to the Brahmana Chikitsa, whatever we are doing, main Vata Vyadhi Chikitsa, that may be Snehana or Brahmana. Snehana will also come under the Brahmana. So that will be the main treatment of Pakshaghata or Vata Vyadhi. Before going to that, it is always better to give a Mrudu Langana. That's why minimum days we are going for the Udvartana or Parishaka. That's 3 days we may give. Okay. So always before going for the Brahmana, it's better to go for a Langana. Because by that doing that Langana, the absorption of the Snehana, the further following Snehana or Brahmana will be more according to the, if you go for a Langana previously. That's why we are generally in all cases, in any type of Vata Vyadhi, we go for a Udvartana or Parisheka. And if we suspect or if we see more DIKSHA E-Lakshanas, then only we will directly go for the Snehana. Otherwise, generally we go for the Udvartana or Parisheka. Then Sukumara Kashaya was given. Again, we see indicated in Vata Vyadhi, Sukumara Kashaya, and again Muda Vata Hara it is. So that is also a concept. And Dhanvantara Patti also again as a Vata Anulomaka it is given. Sukumara Grita was given for a Shamana dosage. And since the patient had some difficulty in passing the stools, we have given Anuloma DS tablet. Now Videshna Dravya, 1 HS we have given. And Shiro Pichu as a Mastishka we have given Shiro Pichu with the Shirabala Taila. It was given. And again, so this treatment was given. After the initial treatment, again Sadhya Virajana was given. So since the patient was able to walk, we have given her Sadhya Virajana, that is with the Sneha Virajana, that is Gandharvasa, the Aranda Taila was given. 60 ml of that Taila was given because it is a Mrudu Virajana. Only Sadhya Virajana, we are giving that for only 1 day. That's why we have given the Sneha Virajana, and 4 Vegas were there. And this Sadhya Virajana is for Vatanulomana as well as the Kosha Shuddhi, because next we are going to plan the Basti Chikitsa. So after this, next day from the Virajana, next day we started with the Abhyanga Sneha Prayogas, Abhyanga Sveda, then the Basti Prayogas was given. That is the Advasana Basti Sukumara Grita was given, and Dashamula Kashaya Basti, because Dashamula is again Vata Kafahara. That's why we have given Dashamula Kashaya Basti. And there was improvements noted. We can see power was improved in the left side. This was a single course of treatment. So we had a improvement in the left upper and lower limbs. Power was improved. Symptoms like other symptoms like stiffness as well as heaviness was reduced. Okay. So this was the observation in the second case. So this is another case of Pittavata Pakshaghata where the patient had again the drowsiness was there. So again, we have correlated with the Murcha or Mada or Brahma, we have correlated along with the Pakshaghata Lakshanas like loss of strength, Ruja, that is pain was there, slurred speech, Vakstamba was there. It was again within 25 days we got this patient, Pittavata Pakshaghata. This is for the findings. In the right side, there was complete loss of function was there and the reflexes were exaggerated. So MRI findings was, it was an acute infarct as well as a chronic infarct was there in the anterior cerebral territory, that's in the frontal lobe. So this was the treatment given. Again, we started with the Udvartana Chikitsa by considering the as a Langana. Then again, Pradimashana with the Lashuna Sarasa by considering the Avarana, not only Avarana, and again the as a Rasayan also. It's a Nasya. It's an it was a case of ischemia. In fact, so that for that also, in that purpose, we have given the Lashuna Swarasa, Nasya. The Nadi Kashayam is a special preparation we have here. It is having some 30 to 40 drugs, Vatahara Devyas are there. That was given, and NeuroXT capsule was given sublingually. And again, Kalyana Girda mainly because of the speech abnormality. Then after this stage of Udvartana, again we have went for the Sneha Chikitsa, Vata Vyadhi Chikitsa, that is Sneha Chikitsa. So Vata Gajangusha Rasa was given. and Mahamanjishtadi Kashaya. So this is also again another condition where we have given the Manjishtadi Kashaya. Because one more thing is this Vata Gajangush Rasa is a drug which is explained for the Vata Vyadhi in Bashir Ratnavali. And for that Vata Gajangush Rasa, it is told it should be taken along with the Manjishta Kashaya as well as Pippali Churna as a Anupana. That is, it's not Mahamanjishtadi Kashaya, plain Manjishta Kashaya. And Pippali Churna as the Anupana. So since we didn't have the Manjishta, plain Manjishta Kashaya was not available, we went for Mahamanjishta Kashaya as the Anupana for Vata Gajangush Rasa with the pinch of Pippali Churna. So that was given. And even this Vata Gajangush Rasa is said to be, or it is taught in the shloka that Saptaha Gridrasim Handi. And again, it will cure the disease Vata Vyadhi within 7 days, it is told. Okay. So this was my thesis topic also in PG. That's Vata Gajangush Rasa in Pakshaghata. And again, so this is one of the potent Rasaushadhi in Vata Vyadhi in Pakshaghata. If it is given with the Anupanas, is Manjishta Kashaya as well as Pippali Churna. Then Abhyanga was given Dhanvandaran Thailam. Anuvasana Basti with Manjishta Thailam only we have given. And the Diruha Basti we have given a Manjishta Kashaya Basti. Okay. So completely considering the involvement of Rakta Dhatu as a Rakta Prasadana and to do the Shoshana is occurred to the Seyasnayu. For the, considering that also we have the given the Manjishta Kashaya Basti, Manjishta Anuvasa Basti also. There we had the good improvement in the patient, that is consciousness was improved. Then even the muscle power also, right upper limb, it was completely zero, complete loss of power was there. It was improved to 3/5 in the upper limb and 2/5 in the lower limb, and the first patient was bedridden because of the loss of power. And at the end of the treatment, patient became, within one course of treatment, she was able to work with support. Okay, so the speech was also improved. So this was the finding what we got in the Pakshaghata in this case. Okay, and this is another condition. Same. This again the Pitavara Pakshaghata. Similar lakshanas were seen, and again here we have used the similar, like Basti Chikitsa was used, and again so this is also another similar case with this is okay. This one was a hemorrhagic patient. Okay, this one we have diagnosed as a Pitta Kaphavrita Pakshaghata, that is drowsiness was there and weakness of left upper and lower limbs was there. Heaviness was there, stiffness was there. So based on the lakshanas, we diagnosed it as a Pitta Kaphavrita Pakshaghata. So muscle power was completely absent. It was zero in the left upper and lower limbs. So hemorrhage was there. So here we can see then the treatment. Similar, Shiropichu was given, Shirapala Taila. Udvartana was given first as a Langana. Then physiotherapy was also given. Shamana Sneha was given Sukumara Grita. Here is another type of Nasya we have used. That is a Pradhimash Nasya with the Yeshtimadu Churna with the Shira and Sharkara was used. Why this is given? Because this was a hemorrhagic case. So many a times the Lashuna as well as Shundi, these things are, according to the modern studies also, it is said to be, it may increase the bleeding. There is a chance of increased bleeding. Okay. So, so there was a study which I read by modern studies. If you give any preparations of this Shundi or this ginger in a patient who takes this aspirin or the blood thinners, there is chance of increased bleeding. That's why, by considering that condition, we didn't go for the Lashona Surasnasya here. And this was not a case of ischemia also. So we didn't go for that Lashona Surasnasya. But here we have given, Yeshtimadu Churna Nasya, that is, Yeshtimadu is a Rekta Pittahara Drevya, and with the milk as well as Sharkara. Again, it is Pittahara. And even this Yeshtimadu preparation or Shira preparation, it is indicated in Rekta Pitta also. So here we have bleeding. So it may help in the stop arresting the bleeding, or it may help in improving the vascular function of brain. By considering that, we have given Nasya with the Yeshtimadu Churna and Shira as well as Sharkara. And here also we have given Manjishta Daila Anuvasana Basti and Manjishta Kashaya Basti was given. So this is another case where we had a Kevala Vataja Pakshaghata. We didn't have any other, what is that? As a samsrishta dosha or avarana was not seen, and this is a dadukshayajanya kevala pakshaghata, or dadushaya was there. That is again like muscle wasting was there. That is not the dadushaya in the brain. Due to the pakshaghata, there was dadushaya. That is the muscle wasting was seen. So it was diagnosed as a kevala vata pakshaghata. This was the power in the right upper arm limb. 3/5 was there. So this was also again. So sorry, this was also hypertensive bleed. So there was dadushaya in the brain also. That is the rakta dadushaya was there, and in the daihika dadushaya, that is nothing but the mamsa dadushaya was there. Muscle wasting was there. So this was the treatment given. Here we didn't go for the what is that udvartana, because it is the dadushaya condition. It's not always better to go for the udvartana because it's a ruksha chikitsa. That's why we have given the dhanyamla and dashamula parishega in this case as a langana, not as a extreme langana with udvartana. And Shirabala 101 Nasya was given. So this is also again Pratimash Nasya. Shirabala 101 was given. So that Nasya with Shirabala 101 was given because it's a Pitta Haradravya. And in Vata, Rakta, it is indicated Shirabala. So Vata and Rakta are involved here also. So that was given. And here the Basti, and we have given the Shashtika Shali Pinda Sveda. That's a Brahmana type of Sveda, or a Snigdha Sveda, Brahmana Sveda. In order to improve the muscle wasting, we have to improve the muscle bulk. We have given this Svedana. And the Basti schedule was Anvasana Basti was given with the ABL Taila, Ashwagandha Bala Lakshadi Taila, because it is one of the Brahmana Taila, and it will improve the Mamsa, also. And the Basti given was Kshira Basti here we are given. That is a Balamula Kshira Basti we have given because considering the Dadukshaya itself. Okay. There was no Samsrita dosha, it was pure Vataja, Dadukshaya Vataja, Kevala Vataja. That's why we have given Kshira Basti. Okay. And there was good improvement in the patient's muscle power also. Stiffness was also reduced. Speech was also a little improved. And so this was the case studies what I mentioned. So in most of the case studies, you have seen this type of Basti schedule. Generally, this is one of the modified Basti schedule what we practice in our institution, because this modified schedule was it was even researches were also done. That is as a PhD research as well as in the Panchakarma department, our own college Panchakarma department. That is the modified schedule of Basti compared with the normal, what is the normal Yoga Basti schedule or Kala Basti schedule. So we had, it was observed that better improvement or little comparatively better improvement or sometimes the equal improvement was given with the modified schedule. That is, so here you can see 26th day, 26th we have given only Anvasana Basti after food, and the 27th day, that is next day, that when we start the Niruha Basti was given in the early morning before food, and the same day afternoon after food we have given the Anvasana Basti. So this was the modified schedule of Basti. So generally we'll one day single Basti, that is the plan what we follow, we usually follow, but this is the thing which we follow in our own institution, where we modified schedule we follow. That is same day 2 Bastis will be given. Okay, so that it will not take more time and will give equal or better improvement also. So these were the case studies what I wanted to discuss. So as a conclusion, things what I included here, that is Pakshaghata can arise in many neurological, vascular or autoimmune disorders like CVA, multiple sclerosis, arteriitis, encephalitis, or electrolyte imbalance, that is a periodic paraplegia. So Pakshaghata is not just, so we have to understand is Pakshaghata is not just the CVA, not just a stroke. The same Pakshaghata Chikitsa can be used or it can be used in a different other similar conditions also. Any other degenerative conditions. It can be even GB syndrome also. It can be in the myelomalacia also. We can use the similar treatment only. Okay. So Pakshaghata is not just a CVA. And even though the underlying pathology varies, the treatment principle of Pakshaghata can be wisely or widely adopted in above said all conditions also. So understanding the symptoms of Pakshaghata in relation with the concept of avarana is of great importance. So whenever we are treating not only Pakshaghata, we need to, as I already told, Shayam Vriddhi Samatvam Cha Tadeva Avarana Bishak Vijnayaha Pavanadinam Na Pramuhyadi Karmasu, it is told. That is, while treating any Vata Vyadhi, we need to take care of Shaya, we need to take care of Vriddhi, we need to take care of Samatva, and most importantly, we need to take care of the Avarana also. Because beautiful Avarana Chikitsa is explained in Charaka Samhita. Samanya Avarana Chikitsa is told, then Dvandva Avarana Chikitsa is told, and again the Vishesh Chikitsa is also told in this Avarana Chikitsa. Even Rasayanas are also told for Vata Vyadi Chikitsa, especially Avarana Chikitsa like Abhayamalakiyam Evoktam. Ekadasha Siddhashadam it is told. That is the Abhayamalaki Rasayana, whatever told in Charaka Samhita Rasayana Pada, that can be used here. Then Shailasya Jatano Atyartham Payasam Gugulostada, that Shilajatu Rasayana can be used. Gugul Rasayana can be used along with the Chira. So this is also indicated. And Lehamba Bhargava Proktam, that is Bhargava Prokta Rasayana is also indicated. Bhargava Prokta Rasayana is nothing but the Chavana Prasha. That can also be indicated. That is also indicated in the Vata Vyadi. So these are the Rasayana Chikitsa. So ultimately, even after the Shodhana Chikitsa or the Panchakarma Chikitsa, for a long time usage to prevent the complications, to bring back the patient to normalcy, we can give Rasayanas also. So these are the commonly given Rasayanas. And even we have SDM products are there like Yashti Madhu Rasayana, Gudichi Rasayana, or Ashwagandha Rasayana is there, and Leshona Rasayana is there, Balamula Rasayana is there. These are again capsule form, single Ekamolika capsule form. These are also found to be more effective because pure extract capsule it is. And what we commonly practice in Pakshaghata, we used to give Leshona Rasayana in Vardhamana dosage or in regular dosage also we give, and Balamula Rasayana with the Chira, that is also practiced more in Pakshaghata cases. Okay. So treatment should be should be planned keeping Pakshaghata Chikitsa Sutra as a base and by incorporating the other lines of treatment. That is, Pakshaghata Chikitsa Sutra is our base. We should treat base of that treatment only, and the other conditions like Vavarana Chikitsa, Gatavada Chikitsa, Achagatavada Chikitsa, or again Samsrishta Dosha Chikitsa, Kevalavada Chikitsa, Upastambhavada Chikitsa. These can also be incorporated along with the Pakshaghata Chikitsa Sutra. Then, and so Ayurveda Chikitsa Sutra is for Pakshaghata is cost effective as well as fruitful also. That is only we can give the maximum benefit to the Pakshaghata patients. See, we know that after the acute management, many of the modern doctors refer the patient for physiotherapy. But more than physiotherapy, along with physiotherapy, if you give the Ayurvedic treatment, that will be more beneficial to the patient. So in the field of Pakshaghata, surely, obviously, we have the upper hand. We have the, we have a lot of things to do. We can do the more improvements in the treatment of Pakshaghata. So these were the references taken. So by this, I would like to conclude my presentation. Thank you for your for listening to me, to my presentation. I think I could impart some of the experiences and some of my understandings to you. So once again, I would like to thank my organizers. Thank you.
Thank you, sir, for taking your time to prepare for such an extraordinary, wonderful presentation, which was incredibly informative.
Thank you.
We will now go ahead to the question and answer session. Shall we begin, sir?
Yes, sure.
Okay, sir. Delegates, please post your questions in the chat box. Or you can raise the hand so that you can ask the questions directly to the sir.
Hello.
Hello, sir. Thank you so much for the really informative session. Am I audible, ma'am?
Yeah, you are audible. You can ask.
Sir, have you been, so I practice in Pune, and have you ever assessed the case when they come from emergency, refer to Ayurveda from modern treatment?
Mainly, ma'am, am I audible to you?
Yes, sir. Yes, sir.
Yes, so many, as we know that many of the times, the acute cases does not come to us. Acute cases will be always going to the modern part. And we'll once they do the acute management, the patient will come to us. So that is a common scenario what we see in the practical life. But sometimes, as we know, there are two types of stroke. There is ischemic stroke as well as the hemorrhagic stroke. So hemorrhagic stroke is considered to be little complicated compared to the ischemic stroke, because there may be if you are not managing the hypertension, or if the hypertension is not managed, or it is still in the higher degree, then the stroke that hemorrhage can progress. So it may cause the death of the patient. So such cases I have not seen, this hemorrhagic cases never comes to us, or if they come also, by seeing by seeing the symptoms also we can understand. Not even before going to the MRI or CT scan, we can see by the presentation we can understand whether it is ischemic or hemorrhagic, because generally the hemorrhagic cases will come in. We will ask the patient first only what time the stroke occurred, what time you observed the symptoms. So they may tell it may be I had the symptoms at the night, or in the early morning they have the symptoms. So such cases may be most of the time still be ischemic strokes, because it occurs in the resting hours. That's not in the active hours. Active hours is nothing but the morning time. That's morning to evening, maybe from 9 o'clock to the evening 6 o'clock. That is the active hours. So generally in this active hours, whatever case occur, most of the times it will be hemorrhagic strokes, because during this time the blood pressure may be a little more. That may induce the bleeding. So many of the cases occurring in this particular time will be hemorrhagic stroke, and in the resting hours, most of the cases will be ischemia stroke, this infarcts. So based on this, we can understand it as a hemorrhagic stroke. And again, the symptoms also. Ischemic strokes may be most of the time will be silent strokes. They will directly develop. The patient will directly develop the motor symptoms or the loss of function. They may be waking up in the morning. They may have difficulty in waking up. Their hands are not moving, legs are not moving. Such symptoms will be seen in the ischemic stroke. But in the hemorrhagic stroke, it is not a silent stroke. Patient will develop either there may be seizures may be there. There may be vomiting will be there. That is projectile vomiting will be there, and sometimes headache will be there. So if the patient explain about such symptoms, that is also suggestive of the hemorrhagic stroke. So if we are seeing such conditions, we may generally refer them to the higher centers. That's the allopathic modern management, emergency management. And so we don't have much things to do in the hemorrhagic stroke. But if it is ischemic stroke, and in the MRI, we may have to go for the that imaging, that CT within the 24 hours. It's better to go for the CT, because ischemic findings will not be seen in the CT scan. Only hemorrhage can be seen within 24 or 48 hours. And if we are not seeing the hemorrhagic findings, we can conclude it as a ischemic stroke, and if BP is normal, we can take such patients. Okay, so there we can again, if the loss of consciousness is there, we can go for the Tikshna Prayogas as told in the Mashtishka Varma Bhigata. Generally, commonly we practice the Yashuna Surasanasya. We have seen such patients also. They have come with the ischemic report. That is a report of ischemia, and their BP is normal. We can take such patients. So still they are in the acute stage only, but still we can take such patients. Okay. So that ischemia cases in acute stage also we can manage, but it is always better to refer the hemorrhagic cases to the first in the initial evaluation. If you are able to understand it as a hemorrhagic case, it is always better to refer them to the higher centers. Yes.
Thank you, sir. Dr. Hema, ma'am, please unmute yourself so that you can ask the questions directly.
Thank you so much, sir, for the previous answer. How Rasaushadhi using Samir Pannagras and Abrakbasma in Pakshaghata is effective according to your experiences, sir?
Okay. Yes, ma'am. So we have this different in Vata Vyadhi, especially we have a wide variety of Rasaushadhis, like as you madam told, Samira Pannagrasam, or again the Vata Gajangush Rasam, Vata Vidwamsa Rasam, Brihatvada Chintamani Rasam, Vata Kulanda Rasam, different medicines are there. So Rasaushadhi, obviously it is told Alpamatra Upayogitvat, Aruchira Prasangada, Chipram Arogidayitvat, it is told. Though very compared to the other medicines, Kashtaushadhis, very minimal quantity we are using. Rasaushadhi, because we have some toxicities also there in that. So considering that we are minimal quantity we are using, but Shipram Arogya Daitva, it will give more effect than the Kashtaushadhi. So based on concept we are using the Rasaushadhis. So as in Samira Pannaga, as a separate drug, I have never used, ma'am. But in this classical preparation like Neurodex, capsule Neurodex or NeuroXT, these are having the this Samira Pannaga acid content. Such things we have used, ma'am. We have, like, and especially in the sublingual form we have used. That is by opening the capsule, we have given that we tell the patient to keep it in the sublingually below the tongue for some 2 minutes. And after 2 minutes, they can engulf that and they can drink some warm water also. So it will go completely to the stomach through the mouth. Okay. So this is this method what we are following. And why I am suggesting this method is because we have clinically seen that even in OPD itself, because in OPD, when this Pakshaghata patient comes now, we have some sample medicines will be there. The medical reps will be giving some, this like Neurodex or Pulse Neuron will be having. Within OPD, we have tried this. That is, we told the patient, we first, before giving the medicine, we first will assess the muscle power. Because muscle power is one of the specific finding, we can easily understandable finding. So we'll assess the muscle power, and then after that we'll give the patient we'll tell the patient to open their mouth. We'll open the capsule. We'll put that powder sublingually. In 2 minutes we'll wait. Then we'll give them some water, and we'll wait for another 2 minutes again. So immediately within some a span of some 5 minutes or 10 minutes, if you assess the muscle power again, there also the improvements were seen in some of the cases. That is immediately that's a wonderful that effect, beautiful effect of this Rasaushadhi. Immediate, it can even improve, give the immediate result. So this is, I am talking because I have clinically, clinically I have experienced this Rasaushadhi, how wonderfully they are acting. So such drugs, if it is given sublingually, that gives more effect, more than the oral application. If you go for the sublingual application, that will give the more benefits. Okay. And generally, if you we need to assess about the hypertension and the cardiac condition also of the patient, because Rasaushadhi is, since given the absorption is more, so we need to take care of such condition also. If they such uncontrolled hypertension or there is no cardiac involvement, then without any other doubt, we can give this medicine sublingually. Yes.
Thank you, sir.
Yes.
There is one more question. What care should be taken for hemorrhagic strokes?
Okay. So hemorrhagic stroke, as I just now explained, the care means most of the times we may have to refer the patients, because hemorrhage, it is a ischemia. What is the difference between ischemia and hemorrhage? Ischemia will be occurring, it will be complete. It may be a small, many of the times only it may be a lacunar infarct. There is a small area of the brain will be affected. That is stopped. There is no further damage. Further damage is not going to occur. But hemorrhage is not like that. Once bleeding occurs, until the BP comes to normal, it continues to bleed. And that is why many of the death occurs in the hemorrhagic case. Hemorrhagic cases, it continues to bleed. That's why generally we are not taking the acute hemorrhagic stroke cases. So this is that while the patient comes to the OPD, the first care should be taken is we need to ask about the complete history. If the patient is unconscious, ask to the bystander, how was the course of that or onset of the disease, whether it was the patient had the symptoms like headache or vomiting or seizure, was there, and what time it occurred. Again, if it was in the active hour, obviously it will be hemorrhagic stroke. Even before imaging, CT or MRI, you can decide it as a hemorrhagic stroke. You need to examine the BP also, and you need to refer to the patient to the higher centers. That's what the main care should be taken in the acute stage. And once they take the acute treatment, and once patient becomes stable, then it is a Pakshaghata stage. Then our role comes. Then the patient comes to after the patient became stable, then they come to us. So we need to treat the Pakshaghata. So there also we need to take care of the hemorrhagic stroke. Don't go. I mean, we should keep the BP normal. We should monitor the patient regularly about their BP and about And again, most these Tikshna Aushadhi should not be given, especially to the nose, like Lashuna Swarasa or Gudanagar Nasya or any Tikshna Nasyas, Pradhamana Nasyas should not be given directly to the nose in the hemorrhagic cases, because it can again cause the bleeding. So that care also should be taken care in the hemorrhagic stroke. Otherwise, you can, the other treatments like Pakshaghata Chikitsa you can do based on the lakshanas, and again the Samsrishtas or Avarana lakshanas, you can treat the Pakshaghata. So these were the special care should be taken in the hemorrhagic cases. Yes.
Thank you, sir. Next question. Please elaborate about chronic cases of strokes.
Excuse me? Can you repeat the question?
Sir, am I audible? Okay. Please elaborate about chronic cases of strokes.
Okay. So regarding the chronicity of stroke, that is also one more important thing, because generally in any other disease we may consider, like if you in arthritis or rheumatoid arthritis, maybe after 2 to 3 years, or 2 to maybe after 5 years, in that case we may consider it as a chronic case. But in the case of this what is that Pakshaghata or stroke cases, this is not the chronicity, because chronicity is little earlier in the case of Pakshaghata. That is, there are some acute, subacute, and early acute cases, and then the chronic cases in the Pakshaghata. That is within maybe within 1 week or after 1 week, the stroke case is considered to be chronic stroke. So within 24 hours, it is acute stroke. 24 to 1 week, or maybe 24 hours to 5 days, it is considered to be chronic stroke, sorry, subacute stroke. And maybe after 1 week itself, it is considered to be chronic stroke. So there starts the chronicity of stroke. Okay, so this is something different from the other diseases. And again, so most of the times while treating, it is always the patient, if they come to us freshly, very within the maybe after 1 week, or within 1 month, or within 1 year. Then if they come within that period, so what we generally observe is, in such patients, the improvement is more. As the year advances, as the disease becomes chronic, that's more chronic, like, maybe 1 year, 2 year, or 3 year, or sometimes within 10 years also we get the patients. But in such patients, the improvement is very much minimal. The main thing is because that patient will be sometimes used to that condition. And so from that, again, a recovery is very much difficult. And the deformities can also occur, like the stiffness or the muscle wasting or the muscle, this tone, that is hypertonicity. This may become permanent in such cases. So from that condition, it is difficult to, whatever, even though you go for maximum Sneha Basti also, whatever Shira Basti also, Yapana Basti also, it will be difficult to take that patient to complete normalcy in the chronic cases. So this is what we have generally observed in the chronic cases. Yes.
Thank you, sir. Next question. Quantity of Lasun Swaras, Yasti and Balashir Basti.
Okay, so quantity that Ishtimadu Taila, Ishtimadu Swarasa, Leshuna Swarasa, Nasya, especially that's Leshuna Swarasa should be, we are using in the 5 to 6 drops. So generally we may go up to, so here it is not only about the drops actually, how much drops you are putting, it is about a Tikshnada of Leshuna. So though it is 5 drops also, it is 10 drops also, Tikshnada will be the same. So generally we, commonly we restrict to 5 to 6 drops. That is a common dose we give in the, this one, Nasya. And the Ishtimadu Nasya, we may go up to 10, because it's a Mrudu Dravya, not Tikshna Dravya. So in such cases, we may go up to 10 drops also with the Shira, with the 10 drops we give. And even this Yashtimadu Churna, along with Vacha Churna, can be given as a Pradhamana Nasya also. It can be used in, Samnya, as a Samnya Pradhavadaga. If patient is unconscious, you can go for this Pradhamana Nasya or Churna Nasya also with the Yashtimadu Churna and Vacha Churna. And again, Shira Basti, in normal, this is normal Niruha Basti Matra. Totally, we may go for along with the Kashaya, Shira, or again the Kalka. Totally, we are generally giving 500 ml or 600 ml also can be given. That is a general, Niruha Basti Matra, what we are discussing. We are commonly giving. Okay. Yes.
Thank you, sir. Next question. What should be line of treatment in chronic patient with only disability in right upper limb?
Only upper limb. Okay. So that is so. This is what the thing. What thank you for asking this question, because this one thing I forgot to explain, because generally in Vatavyadi Chikitsa, two things are told. That is Bahu Shirsha Gadenasyam Panamja Uttara Bhaktigam. Then Bastistu Adonabe. That is, if the Vatavyadi occurs in the Bahu Shirsha, that is above the level of this, hand, or in the that level, or in the upper limb, then the main treatment should be is Nasya. That is Navana Nasya should be given, and Uttara Bhaktiga Snehapana, that is Shamana Snehapana should be given. And if the complaints are occurring the Adonabi, that is a lower limb, Adonabi below the level of umbilicus, then the best treatment is nothing but the Basti as well as Avapida Snehapana. That is the before and after food you need to give the Snehapana. So especially as the person asked, in only upper limb is involved, the best treatment is Nasya only. That is more than the Basti. In upper limb, if only upper limb is affected, go for Nasya. That's a Sneha Nasya. That is Navana Nasya. Just like explained in the Vishwaji Abbahu Korim in Adida also. Navana Nasya, one of the best drug is again the Shirabala 101 avarti of Shirabala Daila used for Nasya. So if you suspect, more Vata, if you need only Vatahara, that's muscle wasting is minimal there, and only Vatahara, like Chashanasha is there, only pain is there, go for Shirabala 101. And if you have this patient has more Dadukshaya, like muscle wasting is there, emaciation is there, along with and that again weakness is there, then you can go for some little more Brahmana Tailas, like Masha Baladi Taila one is there, Masha Saptaga Taila is there, Masha Baladi Taila is there. So that Taila again little more, not only Vatahara, it is Brahmana and Vatahara. Such Tailas can be used there. And otherwise, even Anu Tailas can also be used for this Nasya. If it is again pain is more, again Prasaranya Taila can be used. So these are also again some Tailas used for Nasya in the case of. So based on the condition, we can decide the Taila for Nasya. So if only upper limb is affected, better to go for Nasya and now Uttara Bhaktika Snehapana. That is food, Shamana Sneha can be taken after food. That can also be done. And even Sthanika Chikitsa like Sthanika Abhyanga for upper limb only, Sthanika Svedana, Sthanika. So if again Svedana, Sthanika Abhyanga again with the Tailas like Mahanarana Taila, Shirabala Taila, Dhanvantara Taila, or Bala Taila can be used. And followed by Svedana, Nadi Sveda can be used because it's a single limb, so Nadi Sveda can be given, or Parishaga can be given. And if you need to improve the muscle strength or the muscle wasting is there, you can go for Sthanika, Shashtika, Shalipinda Sveda also. And you can go for Upanaha Sveda also, or again, Veshtana can be done. So Veshtana also the thing what we practice, that is the cotton will be dipped in the Vatahara Taila, because Veshtana is also told in the Ashtanga Hridaya Vadasya Upakrama. So we'll dip the that cotton in the Taila, then we tie it over the affected limb. So Veshtana will also give the good result in single limb, especially the upper limb is affected. Yes, thank you.
Thank you, sir. There is one YouTube question. Shall I read it out, sir?
Yeah, sure.
In Avarana Chikitsa, how Rasayanas can be used? Dose, mode of administration, and duration.
Okay. So Avarana Chikitsa, yes, directly Charaka has explained. Okay, that is a Pittavrta, Samanya Avarana Lakshanas are told, like Pittavrta Vata Chikitsa is told, Kafavrta Vata Chikitsa is told. So if you read a shloka, Pittavrta Vata Chikitsa is complete, is very much similar to the Vata Rekta Chikitsa. And Kafavrta Vata Chikitsa is very much similar to the Amavata Chikitsa. Okay, so these two things are the basic things. And coming to the Pakshaghata, Avarana Janya Pakshaghata, Samanya Avarana Chikitsa is told in the Charaka Samhita. That is, first thing only he says is Anabhishyandi his Nigdahi Shodasam Shuddhikaragi. That is, for Avarana Chikitsa, you need to go for the Anabhishyandi Dravyas, not Abhishyandi Dravyas. So, like, see, some rasayanas, like, you have, so, and it should be Srodasam Shuddhikaragi. What is Abhishyanda? Abhishyanda is a quality which causes the Srodo Rodha. and anabhishya. So the dravya should be anabhishyanta. That there should not be, should not cause the rasayana should not cause any, or the drug should not cause any srodha avarodha. And srodhasam shuddhi karage. He should do the srodha shodhana. So such a type of rasayana is indicated in the avarana. That is, best example is Lashuna Rasayana and Guduchi Rasayana, or even the Gugulu Rasayana, that is Gugulu Rasayana and Shilajatu Rasayana. See, Gugulu is Karshana, it is Kafahara, Medohara, and Shilajatu is also having the same properties. It is Kafahara, Medohara, Karshana. So it will, and it is Lekhana also, it will do the Lekhana. So the Rodha will be removed. So, and that is what we need in the Avarana Chikitsa. And even the Chavana Prasha also, compared to the other Brahmana Rasayanas like Brahma Rasayana or Amalagi Rasayana, or again the Narasimha Rasayana, Rakshavaleha. So the Brahmana property of Yashtimadu is, sorry, this Chavana Prasha is comparatively less. That's why it is also indicated in the Vata Vyadi. It is also indicated in the Avarana. No other, this, what is that, Brahmana Rasayanas are told, not told here. This, so the Rasayanas which are having that Anabhishyandi, it is not going to cause the Abhishyanda. It is not going to cause a Srodha. It is going to cause a Srodha Shodhana. Such rasayanas are indicated. So if you, and the dosage again, if you are giving the Vardhamana dosage, like Lashuna Rasayana can be given, Vardhamana Rasayana, it can be started from 2. So we are practicing the Rasayana in the capsule form. So we are giving 2 capsules in the first day, next day 4 capsules, next day 6 capsules, then 8. We may go up to even 20 capsules a day also. 20 capsules a day at a time with the milk. Then from that again we will come to the minimal dose. There is a descending order. 20, then 18, then so first we start from 2, then we come back to 2. So this is a common pattern what we follow about the rasayana. And the lehya form also, lehyas like Chavana Prasha also, it can be given 2 teaspoons or 4 teaspoons in the early morning with the milk we are giving before food. So there should be maybe some 30 minutes or 1 hour gap, or even 2 hour gap between the breakfast as well as the rasayana, because rasayana is comparatively heavy compared to the other Shamana Aushadhis. So there should be some gap between the breakfast as well as the rasayana. So in the early morning, we used to give that such rasayana with the milk in empty stomach. Yes.
Thank you, sir. There is no more questions left, sir.
Okay,
Thank you, sir. Thank you very much, sir, for patiently answering all the questions. Shall we wind up the session, sir?
Sure, you can do. So once again, I would like to thank you, all the organizers, because this was also an opportunity for me to share my knowledge. So obviously, by sharing our knowledge, we are going to learn more. Okay, thank you. Thank you.
Thank you, sir.
One
Now,
more, sir,
I
one
request
last
Dr.
thing that I wanted to ask. Then one last thing, madam, please. One more last thing I wanted to ask
Yeah.
to sir. Sir, just the upper limb thing which I had asked, the question related to that. Just I have that. If there is avran in that case, then we do we go for patra putri sweat in for local local treatment?
Yes, obviously, because as I already told, again, this avarana we are understanding based on the symptoms like commonly pittavrata vata as well as kaphavrata vata. If pittavrata vata lakshanas are seen, first you start with the treatment with the parisheka, that is dhanyamala parisheka. You can treat dhanyamala parisheka. But if kaphavrata vata lakshanas like gaurava and all it's seen, you can start with udvartana. That is sarvanga udvartana only can be given, because generally we do for the parisheka can be ekanga also can be done, but udvartana generally we go for sarvanga udvartana. So such treatments, Sthanika Chikitsa can also be done in the upper limb if affected with avarana. Okay.
Udvartana with kulita, this kulatha.
Kola churna can be used, or again any other like that Vadhara churnas or Kafara churnas. Mainly Kola churna we are using, or Trifala churna can also be used. Any other churnas can be
and
used.
And when we see the improved, and then
me?
later on, so much patra potuli sweat we can give. Later on, we can go to patra potuli and then shashti.
Yeah.
And then Nastya Pati, you said like we go with you said Shirabala or Nastya treatment. You said we can start with the Anutela.
Yeah. Potali sweat generally we are giving whenever this movement. Yeah, Anutela Nastya can be used. Nastya can be used.
Yeah, but Bruhan Nastya we will be using later on, no? More Bruhan Nastya like.
Yeah, more Brahmana. More Brahmana can be again if the patient has muscle wasting or more such symptoms like muscle power is lost, muscle bulk is lost, there you can go for the Brahmanasya with the Masha Saptaka Taila, Masha Baladi Taila and all. And if only you need only Vatahara, that is like, this weakness is there, then you can go for the Shirabala Taila. And again, if pain is associated, you can even go for Anudaila also, or Shadbindu Taila also, or even, and if movement is affected, more restriction in movement is there, you can go for Prasaranya Taila also for Nasya.
Oh, sir, it was a very nice session, wonderful session. Thank you, sir, very much.
Thank you so much.
Sir, I have one more question, sir. Can you please spare 5 minutes, sir?
Yeah,
sir, you said that Chavanprasha you have to give it early in the morning and with milk. So we in our advices in suggestion to patients say ki amla, Chavanprasha is made up of amla and we cannot give it milk as an upana. So how do you justify?
There's a problem in the connection. No, I didn't hear the question because I had some connection problem. Can you repeat it?
Am I audible, sir?
Now you are audible.
Chavanprasha should not be given with milk as we suggest to patient because of amla and milk in Viruddha Virya. So how is the drug action happens?
Okay. I got the question. So here, so amla rasa, obviously amalaki is having the amla rasa, and amla rasa is contraindicated with the milk. But when we are giving in the rasayana form, that amla rasa is overtaken by the madhura rasa, because many madhura dravyas we are adding, sharkara we are adding, madhura dravyas we are adding. So the amla rasa of amalaki, we are overtaking that. And the other gunas of amalaki is imparted here.
Sir? Sir?
Thank you so much, sir.
Now I request Dr. Tulya Mohandas, Vice Principal, Ayurveda College, Coimbatore, to deliver the vote of thanks.
I think the connection was lost in between. Did you get my answer?
Yes, sir.
There is the amla rasa will be overtaken with the madhura rasa. So rasayana
Sir, you are not audible, sir.
some connection problem. I think it's can we wind up the session?
Yes, sir. Sure, sir.
Okay, thank you.
Now I request Dr. Tulya Mohandas, Vice Principal, Ayurveda College, Coimbatore, to deliver the vote of thanks. Over to you, ma'am. Ma'am is having some connection issues. She will be joining soon.
Hello.
Yes, ma'am.
Is the session over? The questionnaire session is over. Doubt.
Yes, ma'am. Yes, ma'am.
So can I continue? Can you say?
Yes, ma'am.
Thanks.
Over to you.
Okay. I had some network issues, so that was the reason for the delay, actually. Hello.
Yes, ma'am.
Yeah. Okay. Sir, I want to extend my gratitude on behalf of Ayurveda College, Coimbatore, and entire team of DIKSHA. Thank you very much, sir, for giving such an informative session. And I also thank all the participants who are gathered here. And have a wonderful evening. Thank you, one and all.
Thank you, ma'am.
It is not even the beginning of the end, but it perhaps the end of the beginning. Our next session will be on 27 April on the topic Scope and Opportunities of Ayurvedic Research in Abroad by Dr. Madan Tangavelu. To know more about our updates, please do stay connected with our social platform. That's all for today's most interesting session with a lot of new information for us to close our eyes with thought-provoking knowledge. Thank you all for